The Health Secretary joins us in the studio. Morning to you.
Good morning.
Lots to get through. Let's begin with those pensions, though. The BMA are not blaming you, they're blaming the Treasury, and they're saying Treasury tax rules really mean there's no point in working extra hours at all. Do you, as Health Secretary, accept this is a problem, not just, as it were, for well-paid doctors, but a problem for any of us who might have to use the NHS?
Well, we do need to ensure we retain the brilliant staff we have in the NHS. And, of course, I accept the analysis behind this critique. This is an unintended consequence of a different pension tax change that was made a couple of years ago. And it's something that I'm talking to the Treasury about. But ultimately...
And they will act.
Well, it's a Treasury policy, and woe betide me to come and talk about taxes and announce a Treasury policy on the Today programme, Nick.
But in blunt terms, you are able to say to the Chancellor, don't change this, and operations that people depend on will be cancelled and doctors will retire early.
Well, it's about making sure that when there are talented people, these are the people at the upper end of the pay scales, when there are talented people, that we can retain talented people. But it's not all about pay. This is one of a broader set of issues about making sure that the NHS is as good as it possibly can be as an employer, so that it's there for you and me and can really and everybody in this country and can really perform.
And it's some of that you're addressing in a speech today, and you focus in particular on the gender pay gap, which on average is almost a quarter. In other words, men are paid 23% more than women on average.
Yes.
Now, is that a simple issue, which is just up the pay of women?
Well, this is a complicated issue to resolve, but it's a really important one to resolve. I believe in equality of opportunity, and the idea that in the NHS women should, on average, be paid 23% less than men is completely wrong. It's an injustice, but it's also practically a bad idea, because we want to make sure that we promote the best people. You know, just over 3/4 of staff in the NHS are women, 77%. Yet only a minority of people in senior leadership roles, only a minority of consultants are women. And there are barriers, the inflexibility of how work is allocated, a lack of mentoring, a culture which just is too macho and not supportive enough, that makes it much harder for women to progress. And this has not been tackled as much as it needs to, and tackle it we will.
There'll be two rather different groups listening to what you're saying very carefully. There are some will say the last time, though, there was a big increase in the NHS budget, a very high percentage of that money spent by the last Labour government ended up going on pay. Now, some will say it was a total waste, it didn't go on patients. Others will say the NHS is ultimately its staff, and quite right too. So are you ready to spend a lot of the extra money the government's committed on paying staff better?
No, I want to pay staff fairly. So I want to see women finding it easier to be promoted within the NHS. I want more flexibility in how people can work, so that people can balance their family responsibilities, which just as a matter of fact do often fall more on women. I'll give you one example. When we made parental leave equal across the economy and changed the law to do that, that was not implemented in the NHS. It's outrageous, and that needs to change. So now, in any other part of life, if you have a baby, then the father and the mother can take equal amounts of time off. That hasn't been applied in the NHS.
No,
These sorts of things need to change.
Another big health story in the news this morning is the warning from the head of NHS England about a public health emergency potentially caused by people not having the MMR vaccine. More and more children getting measles once again.
Yes.
Yet we heard from Public Health England, separate body, work for you, sounding really quite relaxed about this. OK, the numbers have gone down a bit, but they've improved massively over time. Are you relaxed?
No, I'm not relaxed about this at all. Measles is a horrible disease, but more broadly, we need to tackle this rise in people not vaccinating. One of the things I'm particularly worried about is the spread of anti-vaccination messages online. I've called in the social media companies, like we had to for self-harming imagery a couple of months ago. I'm seeing them on Monday to require that they do more to take down lies, essentially, that are promoted on social media about the impact of vaccination. Vaccination is safe. It's very, very important for the public health, for everybody's health, and we're going to tackle it.
Now, the subject you probably dread being asked about, but the truth is we need to know, which is about Brexit. You've come back from holidays, members of Parliament, ministers as well. Presumably, having had that break and time to think, you can now bring us the breaking news of how the government will break the Brexit deadlock.
Well, no, Nick, because I'm concentrating on running the NHS, and there's so many important things to do in that space. I back
no one would call Brexit a trivial diversion, though, would they? What on earth is the government going to do? You were at the Cabinet yesterday.
I back the Prime Minister to get the Brexit deal through. I've done that all the way through this long process.
But you don't know how she's going to do it.
I want to get a good deal and leave the EU and deliver on Brexit as soon as possible.
Well, let's talk about the politics then, because many in your party are doing that as they contemplated whether to try and fell the Prime Minister again. They say, look at Nigel Farage, look at the Brexit Party. According to the opinion polls, on course to win the European elections, and prominent Tories like Anne Widdecombe joining him. This, they say, is a disaster, so we need to just get out now and get rid of the Prime Minister if she won't do it.
Well, we do need to leave with a deal, and I back the Prime Minister to deliver that. Once we've delivered on Brexit, we then need to turn to face the future. We need to have a positive, compelling vision that is firmly rooted in the centre ground in order to deliver on all the other things that we should be spending our time talking about, and a lot of which we are doing but get no credit for at the moment because Brexit brings this sort of fog in terms of the public debate. So on the NHS, making sure we have equal opportunity, delivering that much more broadly, making sure we define what Britain's going to be in the post-Brexit world, and making sure we have an optimistic, outward-looking vision for our country.
That sounds like the sort of thing might be interesting to talk about in a leadership contest. Do you fancy being able to air some of those ideas in the contest to be the next Conservative leader?
Well, it's not about the personnel, and I back the Prime Minister. It's about the ideas, though, and there is
to be fair, we're going to have a leadership contest within weeks. We now know.
There is an important debate about how you tackle this rise of populism, and I firmly believe that there's a big opportunity for a Conservative Party rooted in the centre ground of politics, which has been abandoned by the Labour Party that's moved off to the left, which can give us an optimistic vision for the future of the country, where we deliver for people, on the economy, on all the other issues that matter to people.
So people look at Farage's success and say, let's have a bit of that populism within the Conservative Party. That seems to work pretty well. Populism is popular. Why don't we have a bit of that?
Well, we need to reject a populism that isn't based on objective fact, on taking the country forward and actually delivering. We are not a party, the Conservative Party, we are not a party of protest that shouts from the outside. We're a party that, at its best, delivers for people. And ultimately, the really important job here is to ensure that a hard left Jeremy Corbyn-led government never makes it to Downing Street. And the way you do that is with a positive vision about how we deliver for the country.
Now, we've heard real anger on the programme this morning, front page of the Times as well, about leaks from the National Security Council. One senior figure in Whitehall says this was evidently briefed to make a leadership candidate look tough on China. You weren't in the meeting, but would you urge colleagues to put the country before their personal ambition?
Yes.
Short and simple. Matt Hancock, thank you.
The time, 19.